Breast cancer treatment choices for women ages 70 and older. This workbook is for women age 70 or older with stage 1 breast cancers that are 2 centimeters or less, which is 3/4 of an inch or less, and with the features below. They are estrogen or progesterone receptor positive, also called ER positive or PR positive. These cancers have receptors for estrogen or progesterone, which are hormones that can cause these cancers to grow. They are HER2 negative, meaning they do not test positive for the human epidermal growth factor receptor. The information in this workbook is from the best studies in the medical literature. It was last updated April 2026. Table of contents. 1. How to use this workbook. 2. What is breast cancer and what are the goals of treatment? 3. Your care team. 4. Considering your overall health and treatment decisions. 5. Surgery treatment choices, mastectomy and lumpectomy. 6. Sentinel lymph node testing. 7. Radiation treatment choices. 8. Hormone treatment choices. 9. Making treatment decisions. 10. Other options. 11. What to think about when deciding on treatment. 12. Questions you may want to ask your care team. How to use this workbook. What is it? This workbook was made to help you consider the benefits and downsides of different breast cancer treatments. A new breast cancer diagnosis may be confusing and stressful. It is normal to feel worried, sad, angry, or frustrated. Thankfully, almost all women age 70 or older with small breast cancers like yours do well with treatment. There is no one-size-fits-all for treating your breast cancer. Each person has their own circumstances that affect their treatment choices. This workbook may help you think of questions to ask and may help you share your priorities with your doctors. How to use it. Some women find it helpful to read this workbook before their first visit with their breast surgeon. Others find it helpful to read the workbook after that first visit for a review. Some women find it helpful to read the whole workbook at one time, while others find it helpful to read a few parts at a time. It may be helpful to share this workbook with family or friends involved in your care. You will need a pen or pencil to complete parts of this workbook. What is breast cancer? Breast cancer means that there are cells in the breast that are growing without stopping. Most breast cancers begin in the ducts that carry milk to the nipple, which are called ductal cancers. Other breast cancers start in the glands in the breast that make breast milk. These are called lobular cancers. There are other types of breast cancer, but they are less common. Treatment options are similar no matter which of these types of breast cancer you have. What are the goals of breast cancer treatment? The goals of breast cancer treatment are to lower your chance that the same breast cancer will come back in your breast, chest, or somewhere else in your body. To lower your chance of getting a new breast cancer in a different spot. To reduce side effects from treatment so you may keep doing what you enjoy doing. To lower your chance of dying from breast cancer. Your care team. There is often a team of doctors, nurses, and other healthcare professionals who care for women with breast cancer. Most women with breast cancer see a surgeon first to talk about surgery. Some also see a radiation oncologist to talk about radiation treatment. Most also see a medical oncologist to talk about hormone treatment or anti-estrogen pills, or to talk about chemotherapy, which is not commonly given for your type of breast cancer. Some also see a counselor to talk about how breast cancer is affecting them. The order of breast cancer treatments when given is first surgery, then radiation treatment, then hormone treatment or anti-estrogen pills. How does my general health affect my breast cancer treatment? It often takes years before a small breast cancer like yours begins to grow or spread. Small breast cancers tend to grow more slowly among women aged 70 or older than among younger women. For women aged 70 or older with other health problems, treating these small breast cancers may not help them live longer. This is because their other health problems may pose a greater risk of death than their breast cancer. Therefore, your general health is important to consider when deciding on your breast cancer treatment. The health questions on the next page can help assess your general health. General Health Review. Answer the questions below and add up your points to learn your health group. Question 1. How old are you? 70 to 74 is associated with 1 point. 75 to 79 is associated with 3 points. 80 to 84 is associated with 5 points. 85 and older is associated with 7 points. Write the points based on your age to the gray box to the right of question 1. Question 2. How much do you weigh? More than 130 pounds is associated with 0 points. Less than 130 pounds is associated with 2 points. Write your points in the gray box to the right of question 2. Question 3. Would you say your health is excellent or very good, which is associated with 1 point, good, which is associated with 2 points, fair or poor, which is associated with 3 points? Write your points to the right of question 3. Question 4. Have you ever been told by a doctor that you had any disease below? Add 2 points for each disease you have or had. Emphysema or COPD, which is associated with 2 points. Diabetes, which is associated with 2 points, which includes borderline or pre-diabetes. Cancer besides breast cancer or minor skin cancers, which is associated with 2 points. Or none of these, which is associated with 0 points. Write your points in the gray boxes to the right of question 4. Question 5. Do you need help from other people with household chores or to go shopping? No is associated with 0 points. Yes is associated with 2 points. Write your points in the gray box to the right of question 5. Question 6. How difficult is it for you to walk a quarter of a mile or about 3 city blocks? Not at all difficult, associated with 0 points. A little or very difficult, associated with 3 points. Can do only with a cane or walker, which is associated with 3 points. Write your points to the right of question 6. Question 7. Which best describes your cigarette use? Never smoked or smoked less than 100 cigarettes in your lifetime. That is associated with 1 point. Former smoker, associated with 2 points. Current smoker, associated with 3 points. Now write your points in the right of question 7. Question 8. During the past 12 months, how many times were you hospitalized overnight? 0 times or no overnight stays, which is associated with 0 points. 1 time, which is associated with 1 point. 2 times or more, which is associated with 3 points. Now write your points in the gray box to the right of question 8. Now add up all of your points in the gray boxes and determine a total. Now circle your health group below based on your total points. 1, 2, 3, 4, 5, 6, 7, 8, 9 points is associated with good health. 10, 11, 12, 13, or 14 points is associated with fair health. 15 or more points is associated with poor health. Mastectomy and lumpectomy. Most women are given a choice of whether to have a mastectomy or a lumpectomy. Mastectomy. The surgeon removes the whole breast. Surgical drains are worn for about 1 to 2 weeks to remove extra fluid. A surgical drain is a tube that is placed at the site of surgery and has a bulb to collect fluid. Some women choose to wear a special bra after a mastectomy. The bra has padding to match the size of the breast. Some women choose to have more surgery to rebuild their breast. This is also called a breast reconstruction. There is a picture showing a woman's breast before and after mastectomy. lumpectomy, also known as a partial mastectomy. A surgeon takes out only the area in the breast with cancer. The rest of the breast stays. This is called breast preservation. More than one surgery may be needed to make sure all of the breast cancer is removed. Most women do not need to wear surgical drains after a lumpectomy. Most women can wear their regular bra after surgery. Sometimes a small pad is needed. Some patients cannot have a lumpectomy because of small breast size, radiation to their chest, or because they have breast cancer in more than one area of the breast. There is a picture below showing a woman's breast before and after lumpectomy. Choosing between lumpectomy or mastectomy. Most surgeons recommend a lumpectomy for women with small breast cancers since 1. Survival is the same and excellent after either surgery. 2. The chance of breast cancer coming back somewhere else in the body is the same and low after either surgery. 3. Women who have a mastectomy are more likely to have problems after surgery, especially women in fair or poor health. 4. Problems after either surgery include wound infections, seromas, which is a collection of body fluid at the site of the surgery, bruising and hematomas. Hematomas are a collection of blood at the site of the surgery, blood clots in the legs or lungs, or death, which is extremely rare after breast surgery. 5. Women are often happier with how they look after a lumpectomy, but this is personal. But for women who choose a lumpectomy, 10 out of 100, 10%, need more surgery since testing after surgery still shows breast cancer in the breast, sometimes called a positive margin or edge. 7. After lumpectomy, women must often decide whether to have radiation to lower the chance of breast cancer coming back in the breast. Radiation is not common after mastectomy. Here is a table to review similarities and differences of these surgeries. Long-term survival is excellent after lumpectomy or mastectomy. After lumpectomy, you can keep your breasts, but not after a mastectomy. After lumpectomy, 90 out of 100 women will only need one surgery, but 10 out of 100 may need another surgery to treat breast cancer. For mastectomy, there is always one surgery unless women choose to have their breast rebuilt, reconstruction. After lumpectomy, women generally do not wear surgical drains. After mastectomy, they do. Recovery time from lumpectomy is 1 to 2 weeks, where it is often 6 to 8 weeks after mastectomy. The chance of breast cancer coming back in the breast or chest is low after lumpectomy, especially with radiation, and very low after mastectomy because the breast is removed. The chance of breast cancer coming back elsewhere in the body is low after lumpectomy or mastectomy. Sentinel lymph node testing. There are small glands called lymph nodes found throughout your body. Doctors used to think that testing the lymph nodes where your arm connects to your shoulder, which is called the axilla, for breast cancer could help inform your breast cancer treatment. The lymph nodes where breast cancer is likely to spread first are called the sentinel lymph nodes. The procedure to test these lymph nodes for breast cancer is called a sentinel lymph node biopsy. It is done at the same time as a lumpectomy or mastectomy. But studies now show that for women with your type of breast cancer, lymph node testing rarely changes the treatment given. Survival is the same whether or not your lymph nodes are tested. Taking out the lymph nodes where breast cancer may spread first, or the sentinel lymph nodes, can cause around 5 out of 100 women, 5%, to have trouble with arm swelling, which is known as lymphedema. The swelling can be uncomfortable and may not go away. Thus, most doctors do not recommend lymph node testing for women with your type of cancer who plan to take hormone treatment or anti-estrogen pills. Radiation treatment choices after a lumpectomy. It is a personal choice whether or not to have radiation treatment after a lumpectomy. Radiation is given to destroy breast cancer cells that may not have been found or taken out during surgery. Treatment is given at a hospital or medical building. Each treatment lasts a few minutes. A machine sends high-energy X-rays into the breast to kill any cancer cells. Radiation treatment lowers the chance of your breast cancer coming back in your breast or chest, but does not affect your survival. Radiation treatment may be given in different ways. It can be given for 5 days a week, Monday to Friday, for 3 to 4 weeks, and sometimes even longer. It can be given 5 days for 1 week only. It can be given once a week for 5 weeks. Doctors are also studying giving radiation to smaller areas of the breast or during surgery. Side effects of radiation. Radiation treatment is generally very safe, and most patients do very well. Some women experience the side effects below. Tired. Many women feel tired during treatment. Around 10 out of 100 women, 10%, are so tired it is hard to do their usual activities. Most get their energy back within a few months after treatment. Breast burning, itchiness, pain, or swelling. Around 30 out of 100 women, 30%, will have pain or swelling in their breast during radiation treatment. The pain or swelling often goes away after treatment is over. Long-term effects and changes in the breast. Around 20 out of 100 women, 20%, report that their breast looks different after radiation treatment. For example, their breast may look smaller. Other long-term effects. After 10 years, around 1 out of 100 women, 1%, may have heart or lung disease because of radiation treatment. Fewer than 1 out of 100 women, less than 1%, get a second cancer due to radiation treatment. Hormone treatment choices. Doctors usually recommend women with your type of breast cancer take hormone treatment or anti-estrogen pills. This is because your type of breast cancer needs estrogen to grow, and women keep making estrogen even as they get older. Taking hormone pills for 5 years lowers the chance of your same breast cancer coming back, your chance of dying from breast cancer, and it lowers your chance of getting a new and different breast cancer. There are 2 kinds of hormone pills, aromatase inhibitors and tamoxifen. Aromatase inhibitors may work a bit better than tamoxifen, so doctors often recommend taking an aromatase inhibitor at some point during the 5 years of treatment. Some women start taking one pill and then switch to another pill if they develop side effects. Aromatase inhibitors. They lower the amount of estrogen in your body. Side effects. Around 30 out of 100 women, 30%, will have muscle pain, joint pain, or stiffness. These are usually mild. Aromatase inhibitors may also cause bone loss, so your doctors may monitor your bone density and give you medicine to protect your bones. Names of aromatase inhibitors: anastrozole, also known as Arimidex, letrozole, also known as Femara, or zemestane, also known as Aromacin. They all work equally well. Tamoxifen. It keeps estrogen away from cancer cells in the breast. Side effects. A slight increase in the chance of cancer in your uterus, or known as the womb. It also lowers your chance of having a stroke or blood clots. But tamoxifen lowers your chance of bone fracture. Both kinds of anti-estrogen pills may increase hot flashes, night sweats, and vaginal dryness. Your doctor can help you manage these side effects. Making treatment decisions. There is no one approach to treat your type of breast cancer. The best treatment path depends on what matters to you. Some women prefer to have treatments that lower the chance of their breast cancer coming back in their breast or recurrence, even if the treatment is unlikely to help them live longer. Others prefer to skip these treatments since the chance that the treatment will help them live longer is small. There are downsides to treatment, and if the breast cancer comes back, it is usually treatable then. For women in fair or poor health group from page 5, the chance of dying from their other health conditions is much greater than their chance of dying from breast cancer, so their chance of benefiting from breast cancer treatment is lower. Doctors say that women aged 70 or older with your type of breast cancer may skip radiation treatment if they are willing to take anti-estrogen pills for 5 years. Some women may choose instead to have radiation treatment and to not take anti-estrogen pills. The graphs on the next 2 pages show the chance of breast cancer coming back in the breast or chest or elsewhere in the body, and breast cancer survival over 10 years for 4 different treatment pathways. Treatment path 1 is lumpectomy, radiation treatment, and anti-estrogen pills. Treatment path 2 is lumpectomy and anti-estrogen pills, but no radiation treatment. Treatment path 3 is lumpectomy and radiation treatment, but no anti-estrogen pills. Treatment path 4 is a lumpectomy only, no radiation treatment, and no anti-estrogen pills. For women who have a mastectomy, outcomes are similar to women who choose lumpectomy and radiation treatment, which is treatment path 1 or treatment path 3. What happens to 100 women aged 70 or older over 10 years who choose treatment path 1 or treatment path 2? Graph of treatment path 1, which is again lumpectomy, radiation, and anti-estrogen pills. 2 out of 100 women, 2%, have breast cancer come back in their breast or chest over 10 years. 5 out of 100 women, 5%, have breast cancer come back somewhere else in their body over 10 years. 3 women, or 3%, die from breast cancer over 10 years. 97 women do not. Treatment path 2, lumpectomy and anti-estrogen pills, but no radiation treatment. 9 out of 100 women, 9%, have breast cancer come back in the breast or chest over 10 years. 5 out of 100 women, 5%, have breast cancer come back somewhere else in their body over 10 years. 3 women, 3%, die from breast cancer over 10 years. 97 do not. Summary: over 10 years, 7 fewer women out of 100, 7%, who have a lumpectomy, radiation, and take anti-estrogen pills or treatment path 1 will have breast cancer come back in their breast or chest compared to women who have a lumpectomy and anti-estrogen pills but do not take radiation or treatment path 2. For women who have a lumpectomy and take anti-estrogen pills, radiation does not lower the chance of breast cancer coming back elsewhere in the body, nor does it change survival. The chance of having breast cancer come back somewhere else in the body and the chance of dying from breast cancer is the same for women who choose treatment path 1 or treatment path 2. What happens to 100 women aged 70 or older over 10 years who choose treatment path 3 or treatment path 4? Treatment path 3, lumpectomy and radiation, but no anti-estrogen pills. 10 out of 100 women, or 10%, have breast cancer come back in the breast or chest over 10 years. 6 out of 100 women, 6%, have breast cancer come back somewhere else in their body over 10 years. 4 women, 4%, die from breast cancer over 10 years. 96 do not. Treatment path 4, lumpectomy, but no radiation treatment, no anti-estrogen pills. 25 out of 100 women, 25%, have breast cancer come back in the breast or chest over 10 years. 6 out of 100 women, 6%, have breast cancer come back somewhere else in their body over 10 years. 4 women, 4%, die from breast cancer over 10 years. 96 do not. Summary: over 10 years, 15 fewer women out of 100, 15%, who have a lumpectomy and radiation, treatment path 3, and 16 fewer women out of 100, 16%, who have a lumpectomy and anti-estrogen pills, treatment path 2, and 23 women out of 100, 23%, who have a lumpectomy, radiation, and anti-estrogen pills, treatment path 1, have breast cancer come back in their breast or chest compared to women who have a lumpectomy only, treatment path 4. Radiation lowers the chance breast cancer will come back in the breast or chest wall, but does not affect survival. 1 less woman out of 100 who take anti-estrogen pills will die from breast cancer compared to women who did not take anti-estrogen pills, treatment paths 1 or 2 versus treatment paths 3 or 4. Other options. Choosing not to have surgery. Some women cannot have surgery or choose not to have surgery. These women may take anti-estrogen pills instead. This is called primary endocrine therapy. After 10 years, survival is the same between women who have surgery and those who take anti-estrogen pills only. No surgery, no radiation. But since your breast cancer may keep growing without surgery, doctors usually recommend surgery unless you are in poor health or cannot have surgery. cryotherapy or cryoablation, freezing the tumor. Some doctors are using cryotherapy instead of surgery to treat breast cancer in women in fair or poor health. These women may still take anti-estrogen pills. In cryotherapy, a doctor puts a small needle through your skin and into the cancer. The tip of the needle gets very cold, like ice. This cold freezes the cancer cells to kill them. Over time, your body clears away the dead cells. Some women have bruising after cryotherapy. Rarely, women have skin burning. You may have to go for more imaging tests after cryotherapy than after surgery to make sure the breast cancer is gone. Cryotherapy may be given more than once. Chemotherapy. Since other treatments work well for your type of breast cancer, and since the chance that your breast cancer will come back is already low, few women with your type of breast cancer benefit from chemotherapy. Genomic testing. These tests examine genes in your breast cancer tissue removed during surgery. The tests give you a score on how likely your breast cancer is to come back. Since most women aged 70 or older with your type of breast cancer have low risk scores, these tests are not often used for your type of breast cancer. Doctors are still studying how best to use these tests. Below are some things to think about when deciding on treatment. How strongly you feel about each item below may help you decide with your doctors which breast cancer treatment to have. How important is each of the following to you? Circle your answer. How important is it to keep my breasts? Not at all important to me, a little important to me, somewhat important to me, very important to me, extremely important to me. 2. To avoid radiation treatment. Not at all important to me, a little important to me, somewhat important to me, very important to me, extremely important to me. 3. To lower the chance of my breast cancer coming back. Not at all important to me, a little important to me, somewhat important to me, very important to me, extremely important to me. 4. To lessen the time I spend going to appointments or treatment visits. Not at all important to me, a little important to me, somewhat important to me, very important to me, extremely important to me. 5. To avoid side effects from medication. Not at all important to me, a little important to me, somewhat important to me, very important to me, extremely important to me. Which treatments do you think you prefer? Your preferences may change over time, but it may help to think about what you may want at this time. Circle what you prefer below. 1. If you think you will have surgery, which surgery are you thinking about? I will have a lumpectomy. 1. 3. I'm not sure. 5. I will have a mastectomy. 2. If you think you will have a lumpectomy, do you think you will have radiation treatment? 1. I will have radiation. 3. I'm not sure. 5. I will not have radiation. 3. Do you think you will want to have hormone treatment or anti-estrogen pills? 1. I will take anti-estrogen pills. 3. I am not sure. 5. I will not take anti-estrogen pills. Questions you may want to ask your care team. What are my treatment options? For how long will I need to be treated? Will this treatment keep my breast cancer from coming back in my breast or chest? Will this treatment keep my breast cancer from coming back elsewhere in my body? Will this treatment help me live longer? Could this treatment affect my general health or my other health problems? Can you tell me any problems that I may have from this treatment? Will this treatment affect my daily life? If so, for how long? What may happen if I choose not to have this treatment? What resources or support groups are there for women over 70 with breast cancer? Additional notes and questions. Please use this workbook to talk to your doctors about treatment choices. This work was supported by the National Institutes on Aging of the National Institutes of Health. Copyright 2026 by Beth Israel Deaconess Medical Center on behalf of its employee, Mara A. Schonberg. All rights reserved.